This is the Supervised Toothbrushing Training for Early Years and Educational Settings funded by Harrogate District NHS Foundation Trust. The information in this training has been sourced from the 2016 Public Health England Guidance Document, Improving Oral Health, Supervised Toothbrushing Programme Toolkit. It is requested that early years and educational settings run the scheme as detailed in this programme and in line with evidence-based Public Health England guidance rather than implementing their own systems. The aim is to deliver an effective supervised toothbrushing scheme in early years and education settings. The Toothbrushing Programme is a nationally recognised, evidence-based oral health initiative for children, which is designed to improve children's oral health, increase exposure to fluoride, promote behavioural and self-care skills. The objectives are to provide supervision and ongoing support with staff training, cross-infection control, consent for participation. Implementing the programme. It is a requirement of the programme to assign a designated lead person who will be responsible for ensuring staff training is completed and monitored, gaining and storing records of consent, ensuring cross-infection procedures are followed, maintaining contact with your named dental professional. Your dental professional will provide training and support in providing the programme, toothbrushes, toothpaste and storage racks, assistance implementing the toothbrushing initially in the classroom, annual face-to-face visit and oral health talk to children and parents. Consent. Consent letters will be supplied for schools and nurseries to send out. The forms should be resent again for any non-responders. Only children with consent can participate in the programme. Toothbrushing. This should be organised in a safe and effective way which is integrated with nursery, school and home routines. It is important that children are encouraged to also brush teeth twice a day at home. Toothbrushing can be carried out in groups or individually, and children can be seated or standing. It should be completed at an appropriate time for your class, and children should be encouraged to brush their own teeth using a method which is appropriate to the child. Toothbrushes are appropriate to age and ability. They are replaced each full term and are individually identifiable for each child. Toothpaste. Regular daily toothbrushing with an appropriate fluoride toothpaste is highly effective in preventing dental decay. Toothpaste must contain at least 1,350 parts per million fluoride. A smear of toothpaste is used for children under 3 and a pea-sized amount for children aged 3 and over. Children should be discouraged from swallowing toothpaste during or after brushing. Once brushing is complete, children should not rinse, and any excess toothpaste can be wiped away. Cross-infection. Supervisors should wash their hands before and after the session and cover any cuts or abrasions with a waterproof dressing. Toothpaste must not be applied directly to the toothbrushes. Toothpaste should be dispensed onto a clean surface, such as a plate or paper towel. There must be sufficient spacing between the quantities of toothpaste dispensed to allow transfer to each child's brush without cross-contamination. After toothbrushing, brushes are to be rinsed thoroughly and individually under cold running water and placed in the storage system to allow them to air dry. Toothbrushes should not be washed together in the sink and should not touch the taps or sink when being rinsed. Toothbrushes must not be soaked in bleach, cleaner or disinfectant. The toothbrush racks comply with best practice in the prevention of cross-contamination. Toothbrushes are kept upright, allowing enough distance between toothbrushes to avoid cross-infection. Brushes and racks have corresponding symbols, allowing for individual identification. Storage systems must not be kept in toilet areas and must be kept out of reach of children. Storage systems will be supplied with covers, which must be used at all times. Cleaning procedures. The storage systems should be wiped daily to remove any drips. The storage systems should be washed weekly with household detergent and warm water. Dedicated household gloves should be worn and all cuts and abrasions covered with a waterproof dressing. Storage systems, trolleys and storage areas are cleaned, rinsed and dried at least once a week. The storage systems should be replaced if they become cracked, scratched or rough. Although it is not recommended to brush straight after food or drink, it is acceptable for schools and nurseries to fit in toothbrushing around routines and implement at a suitable time. Monitoring of the toothbrushing programme will include observation of the toothbrushing session, discussion of performance against the checklist with the key settings designated lead, feedback to the overall programme lead, and arrangement of a follow-up visit. All settings will be provided with a copy of the standards and guidelines. Supervised toothbrushing supplies and resources can be found at a number of retailers, including the Toothbrush Rack Company and the Oral Health Foundation's Health Education Shop. Toothbrushing procedure. Supervisor washes hands before and after toothbrushing. Under supervision, children collect their toothbrush from the rack or supervisor hands brush to each individual. Children are seated or standing to brush teeth. Toothpaste is dispensed onto paper towel or a clean plastic plate and applied to the toothbrush. Children brush for 2 minutes. After brushing, any excess paste is wiped onto paper towel. The paper towel is to be placed in the bin. Each child then rinses their brush one at a time or places the brush in the rack to be rinsed by a member of staff. Children should not touch each other's brush. Brushes are left in the rack to air dry for 1 hour, then the lid is placed back on the rack. Paper towel is to be used to wipe away any visible drips on the storage system. After toothbrushing is complete, children and supervisor wash hands. Thank you for watching. If you have any further questions, please contact the Oral Health team.